So, how much do you think you know about health and well-being? And I'm not talking about yoga and getting enough celery every day. I'm talking about even deeper into health and well-being, especially for the human being. We're not going to talk about goats in here, so that's what you're expecting. This is about human beings. I didn't specify it, so just in case, this is just about humans. Question 1. Alright, so Ronnie maintains a positive outlook on the future and himself, even though he doesn't think that his coping skills are exceptional. Psychologists who study stress would assume that Ronnie would score high on a measure of what, which has been shown to be a what kind of factor with regard to the detrimental effects of stress. The answer is optimism and protective. So self-efficacy, in case you're not aware, is the belief in one's abilities to achieve a set task or goal. And everything else protective is, as it sounds, it's something which protects you from something, stops you from getting hurt. Empathy is the ability to extend your emotional, be able to feel what someone else is feeling, understand what they're feeling. And vulnerability is pretty much the opposite of protective, and invulnerability is that you're just so strong you don't even need protection. Hardiness, as it sounds, you're pretty much built for anything. Optimism, remaining optimistic, positive outlook, there you go. Studying stress would score high on a measure of optimism, which has been shown to be a protective factor. So when Ronnie feels stress, his optimism stops him from feeling a heightened sense of stress. He'll still feel it, he's not immune. Question 2. You are a surgeon who is about to perform hip replacement surgery on a patient. If you wanted to reduce the amount of pain that the patient was going to experience after the operation, which of the following would you do? The answer is D. Provide the patient with information about cognitive coping strategies that have been shown to be effective in managing pain. When the pain comes, the patient does not overreact or think that something is wrong, and this can often make the pain worse. Question 3. Which of the following statements... Okay, hold on. Let me give an example. So if they've just had heart surgery and this person isn't too familiar in the whole surgery process, and the surgeon's like, I better not tell them about the intense amount of pain they're going to feel while breathing, that patient's going to wake up, they're going to feel in a lot of pain. The surgeon's not going to be around because he's done his work. He needs to go work on someone else. So who's going to explain what's happening? So now this patient's going to freak out and possibly, cause even more damage. So it's a good idea for the surgeon to tell them what to expect. Question 3. Which of the following statements is not true about contributors to happiness? So is it true that happiness and IQ have a strong positive correlation, that brighter people are generally happier? Is it true that even when current income and wealth are combined, it's clear that money never buys happiness? Is it true that happy people typically have more satisfying social relationships than unhappy ones? Or is it true that people with pain-free disabilities can often adapt and reach a reasonable degree of happiness? The answer is B. Even when current income and wealth are combined, it's clear that money never buys happiness. This is due to Hedonic Adaptation. If you're not familiar with Coursera already, they've got a really good course on the science of well-being, which I recommend you to take, which explains all of this in science. Question 4. Jessica has sought substance abuse counselling. She's remained drug-free for several months, but last week she ran into some old friends and used drugs with them. Afterward, she felt terrible and concluded that she must not have the self-discipline and willpower needed to quit, and so within a week, she'd fully resumed her harmful drug behaviour. This example best demonstrates the phenomenon called what? The abstinence violation effect. Now, I'm pretty sure I explained all of these. So the abstinence violation effect, AVE, refers to the negative cognitive and affective responses that an individual experiences after the return to substance abuse after a period of abstinence. The insufficient justification effect, this is how individuals deal with cognitive dissonance. They find an internal cause for an explanation to behaviour because there isn't an external cause. So here's an example. So there was an experiment by Festinger and Carl Smith where a participant performed a really boring task. Afterwards, they were asked to be dishonest to the next participant by lying about how fun and entertaining the task was. Now, one group of participants was given $1 for lying, while another group was given $20 to lie. They found that the $1 group rated the task as being a lot more fun than the $20 group. The insufficient justification effect occurred. Both groups needed a justification for being dishonest. The $20 group had an external justification, getting $20, while the dollar group didn't, so they developed an internal justification, that the task was more fun than it actually was. So there you go. Cognitive dissonance is an unpleasant state of mind that occurs when two conflicting beliefs or thoughts are held at the same time. The insufficient justification effect is when a person finds an external cause for an explanation. I'm just making sure I get this, because cognitive dissonance is something that we're all susceptible to. So I've got to make sure I got a grip on this, not just for my exam, but just for life in general. So this effect reduces cognitive dissonance by justifying behavior internally when there's insufficient external justification. Now, with our case here, so Jessica, her feeling terrible and concluding she does not have the self-discipline and willpower and returning back to drug behaviors, it's not self-justification or the lapse justification effect. It's just she had a period where she was drug resistant, and then she had a little bit, and then she's like, okay, I don't have the willpower, and she just goes back into it. So she had the capacity to refrain from it, but she convinced herself that she's not strong enough. So she's violated her abstinence. Okay, question 5. Steve and his romantic partner are having difficulties in the relationship. Steve starts to get anxious when he thinks, oh no, we might break up. And if that happens, everyone will think I'm an idiot and a complete loser. Thoughts like these are best classified as appraisals of what? Consequences and personal meanings. There's not really much fancy psychological terminology here. It says it sounds. There's going to be consequences here. If he breaks up, this is the consequence, and personal meanings that he'll be an idiot and a complete loser. Question 6. Harris is being treated unfairly by his boss. Rather than confront him, Harris changes his appraisals of his boss's behaviour in order to deal with it. For example, my boss is probably having a horrible day and I bet she's very upset by the fact her husband died. Harris's coping strategies are best classified as examples of what? Emotion-focused coping. So there's problem-focused coping and emotion-focused coping. Do I explain it? I do. Problem-focused coping targets the causes of stress in practical ways, which tackles the problem or stressful situation that is causing stress, consequently directly reducing the stress. Problem-focused strategies aim to remove or reduce the cause of the stressor. Whereas emotion-focused coping helps you deal with stress by avoiding negative emotional responses associated with stress, as anxiety, depression, and frustration. Question 7. Kathy has just undergone root canal. That stuff is painful surgery and is attempting to cope with her post-operative pain. When the pain gets particularly bad, she turns on her TV and plays a video game until the pain lessens. Kathy is using which of the following pain management strategies? Dissociation. So let's walk through these terms. Association, cognitive restructuring. So cognitive restructuring is a common cognitive behavioral coping strategy where we evaluate, think about ourselves, the people and events can have a major impact on our mood. Cognitive restructuring focuses on identifying negative thoughts or evaluations and modifying them. That is definitely not what Kathy is doing. And the other one's association. That just doesn't make sense at all. Cognitive, that just... No, none of them. Those two I don't think are even really in psychological terms in this context of health and well-being, so dissociation makes the most sense. Question 8. Bob decided that he was a bit overweight, so he created a new exercise program. Although initially he had some difficulty sticking with it, he has consistently done his exercise workout for the last 8 months. The program is still not yet automatic for him, and he reinforces himself by buying a new shirt each month if he has successfully completed his workouts. Bob would probably be classified as being in what stage? The maintenance stage. So there's 6 stages of change. In case you weren't aware, there's pre-contemplation. So say you're a smoker or, you're not happy with your weight. We'll use a smoker example. So the pre-contemplation would be sort of thinking about smoking instead of passively doing it. Just like, okay, this is smoking. Is it good or bad for me, And then there's the actual contemplation where they really start thinking about, okay, do I want to stick with this? I don't think I do. And then the preparation, they start to think, okay, well, I know there's a help, there's a kind of group therapy nearby. Maybe if I join them, they can help me quit. If I stop buying cigarettes from this shop and I tell myself I only have to buy it from a shop half an hour away because it's cheaper there, or nicotine, or all of these other things, they start preparing, and then they act, and they put everything that they prepared into place. And then there's the maintenance period where because you've been smoking for a long time, you can't just instantly quit on these things. So there's going to be a period of time where they fight against this old urge, and then they fight long enough, then the habit will be terminated and they will change their behavior. So as you can see here, he's buying a new shirt each month if he successfully completes his workout, so he still needs some motivation to prevent him from going back to his weight. So yeah, Bob is in the maintenance stage. Question 9. 2 of the most important factors for overcoming early childhood disadvantage are what? Good intellectual functioning and a supportive relationship with a caring adult. Alright, now that is pretty much it. And that's a summary that I did not put any effort in because everything is relatively well explained. So hopefully you've learned about the different coping mechanisms for pain, the different ways for change, and as well as a few mini case studies. Thanks for watching.